Hello, I'm Dr. Meenu Jindal, a pediatrician practicing in North Texas. I'm going to talk about A1C testing and how it can help prevent or manage diabetes. What is an A1C test? An A1C test measures the average amount of sugar or glucose in your blood over the past 3 months. It is a simple blood test that healthcare providers use to detect diabetes, help diagnose type 2 diabetes, and see how well your diabetes management plan is working. When would I need an A1C test? If you have diabetes, you should have an A1C test performed about 2 times per year. Every case is different, and your healthcare provider can recommend exactly how often you should get tested. If you don't have a diabetes diagnosis, your healthcare provider may order an A1C test if you show symptoms of the condition, including intense thirst, increased urination, blurry vision, intense fatigue. Healthcare providers may also order A1C tests to screen for type 2 diabetes. Some risk factors include being over the age of 35, family history of type 2 diabetes, personal history of gestational diabetes, obesity, and lack of activity or exercise. What should I expect during and after an A1C test? Since the A1C test requires a blood sample, you can expect the following. First, you'll sit in a chair and a trained member of the office staff will check your arms for an easily accessible vein. Once they've located a vein, they'll disinfect the area, insert a small needle into the vein, and begin collecting the blood sample in a test tube. When they have enough blood for the sample, they'll remove the needle and hold a cotton ball or gauze on the site to stop the bleeding. Finally, they'll place a bandage over the site and you'll be finished. What are the risks of an A1C test? There's very little risk with an A1C test. You may have slight tenderness or bruising on the arm, but this usually resolves quickly. I am Dr. Meenu Jindal, a pediatrician practicing in North Texas. A1C testing can help prevent and manage your diabetes. Contact your family doctor to learn if you should get tested.